When you're having trouble having sex, you are stressed about it, you are thinking about it, and it's affecting your quality of life because you're not in the moment. I'm Dr. Rena Malik, urologist and pelvic surgeon, and welcome back to the Rena Malik MD podcast. Today we have our monthly AMA, and we are going to be answering your questions from our membership and our subscribers. If you want to be a member and see the full-length episode of our AMA, make sure to sign up at renamalik.supercast.com, where you can ask me anything and get early access to all of our podcast episodes as well as transcripts from the membership. So let's get right to it.
How is the strength of an erection measured? How is ED determined? And is there a maximum hardness that you think women would notice a difference with?
Yeah, so there is a erectile hardness score that you can use that's been used in studies to determine how hard an erection is. And it goes from 1 to 4, grade 1 being not hard enough to penetrate with. Grade 2 is hard enough for intercourse, but not completely hard. Grade 3 is hard enough for intercourse and mostly hard. And grade 4 is completely rigid and hard for intercourse. And so again, that's really vague, but ultimately it's really dependent on you. So you knowing what your hardest erection has ever been and sort of just subjectively determining, is it less firm or more firm? The most important thing for us as clinicians is that it's hard enough for intercourse. But I understand that patients want it to be as rigid and hard as possible. And so I think, this is where I don't know that it's actually been looked at in terms of, is there a scientific point at which partners notice it's a little less hard? I think that's difficult to say, but ultimately that is sort of something that, you can talk to your doctor about. Look, it feels hard, but it's not as hard as it used to be, or it's sort of mostly hard, or it's not completely hard. And those are such terminology that you can sort of bring to your doctor. But there is a way that we essentially determine erectile dysfunction. So typically you'll get a questionnaire. There are longer versions, but typically it'll be about 5 questions that ask you, your confidence in being able to obtain an erection, how often you've been able to have an erection that was firm enough for intercourse. And based on that, you get a score. And that score gives you then a severity of erectile dysfunction. If your score is high, then you have no ED. If it's, slightly lower, it's mild, then it goes to moderate, then it goes to severe based on this scoring system. And so ultimately, all these sort of technicalities don't matter. What matters is, are you having good erections that you are happy with and your partner is happy with? And if not, then we need to talk about it and figure out what's going on. I think that's really the most important thing. Is like, yes, there are all these technical things that we use in urology, but at the end of the day, our goal is to make sure that you are able to have penetrative intercourse and be happy and satisfied with it with you and your partner. And sometimes that's a medical issue where there's an organic cause, like your blood flow issue or a nerve issue or a hormonal issue. And sometimes it's a psychological issue, and we have to sort of figure out what's going on and help you navigate that.
Next question is quite specific. It's quite long, but it's a topic that covers SSRIs, which I know you've talked about on the channel in the past. But basically, it seems like this patient suffers from depression, is on SSRIs, and maybe you can discuss what those are, and the patient has some sexual dysfunction. So he's kind of wondering, how urologists coordinate their care with other medical specialties like psychiatry. And then maybe you can also give some feedback about SSRIs and sexual dysfunction.
Okay. So in terms of, I think this is just generally a good place to talk about how you should manage multiple doctors, right? And I think it's very hard as an individual. You have an issue, you go to a doctor, and obviously that issue sometimes overlaps with multiple things. So very often I tell everybody that sexual dysfunction always incorporates some psychological component. And this is because when you're having trouble having sex, you are stressed about it, you are thinking about it, and it's affecting your quality of life because you're not in the moment. You're not enjoying the pleasure. You're more worried about why you're having that particular issue and if that issue is going to arise again in this particular encounter. And so there's not a single person who's just having an issue with their body that it's not affecting their psychology. And so in those cases, I generally recommend all my patients to see a sex therapist or a psychologist with expertise in sexual health to really sort of dig deeper in this. But I realize that's not accessible for everyone, and not everyone feels comfortable doing that. But ultimately, I think that's really important. Now, in terms of communicating with multiple doctors, so if I refer you to someone, typically there's going to be some crosstalk between me and that doctor, right? If we know each other, we would likely get on the phone and talk to each other. If we don't know each other very well, sometimes we'll send notes to each other and then talk if there's an issue that we need to discuss about. But again, it's really individualized. I think the most important thing is realizing that, hey, talk to your doctor. Say, hey, I'd love it if you would communicate with my other doctors. They would know what's going on with me. Also, you are your own quarterback. And I think people forget that. Nowadays, you are legally able to get all your medical records. You should have access to them. Most doctors have a patient portal where you'll see the notes from your visit and you'll be able to see what the doctor wrote. And so you also can print those out or message them to your other doctor and say, hey, this is what happened at that visit. And I want you to have a record of it so that you can help people sort of know what's going on with you. And ultimately, your primary care doctor should be acting somewhat as a quarterback too, to help make sure that you're getting the referrals that you need and that you're seeing the doctors that you need to see. But ultimately, I would say, the most important thing is for you to be empowered to make sure you get all your records, keep them secure, keep them in a place that you have access to them, because that's going to be the number one way that when you see a new doctor, you can share those with them and they can understand what other doctors have worked with you on, what they've found, what they've tried you on in terms of medication, and what their thoughts were about you. And I think that's the number one most important thing. One more thing I would add is also, if you are in a system, sometimes it's easier to communicate within that system. So for example, when I see patients, when I work at the VA hospital, I can see all their notes from all their other doctors, and I can message all their doctors pretty easily because they're in the system if I have a question, and get a relatively quick response back. And so I think that's really important. If you tend to like a system, it's great to stay within that system because you can get that sort of crosstalk a little bit more easily. In terms of SSRIs causing sexual dysfunction, we do know that SSRI medications or antidepressants can cause sexual dysfunction. And that can vary in how it presents. Often it can present with low libido. It can affect ejaculation or erections for men. It can affect orgasms for women. But ultimately, it is dose dependent. And so some people may notice that when they're on lower doses, they don't have any problems. But when they go on higher doses, they do. So it's important to bring that up with your doctor. They know that they have these side effects, whether it's your psychiatrist or your primary care doctor that's prescribing it. They know that these are side effects. And so they should be able to be equipped with the knowledge to say, hey, I'm going to decrease the dose and see how you do. We have to sort of manage how good are your psychological symptoms managed as well as your sexual side effects. And there are other medications, alternatives that have less sexual side effects. And so again, talking to your doctors and being open with them, saying, hey, I'm noticing this since I started the medication. Because if you don't tell them, they may not ask you. And it's important for you, again, to be your own quarterback and be your own advocate. Thank you guys so much for joining me today. If you want to get the rest of the questions that I answered on today's AMA, make sure to sign up for our membership at renamalik.supercast.com, where you can access our AMA and ask questions there. You can also get access to early releases of the podcast as well as transcripts from the podcast. So make sure to check that out. And if you guys are enjoying this, please make sure to share this channel with your friends and let them know about the channel. And if you're not subscribed, what are you waiting for? Make sure to subscribe to the channel, show your support with just one click of a button. And as always, remember to take care of yourself because you're worth it.